If you have Crohn's and your joints hurt, your eyes get inflamed, or you're dealing with weird skin rashes, and your doctor keeps treating them as separate issues, this video is for you. Because 30% of us deal with extraintestinal symptoms that are actually part of the same inflammatory process. Hi, I'm Kate, and today we're talking about extraintestinal manifestations of Crohn's, the symptoms that show up outside your gut but are absolutely connected to what's happening inside it. This matters right now because you might be bouncing between specialists, getting separate treatments for each symptom, when what you really need is an integrated approach that addresses the root inflammatory pattern. My son was about 6 months into his Crohn's diagnosis when he started complaining about his knees. Not a little soreness, actual pain that made him limp some mornings. We went to the pediatrician who suggested growing pains, then an orthopedist who couldn't find anything wrong structurally. Nobody connected it to his Crohn's until I asked his gastroenterologist directly. And in my practice, I see this all the time. Someone's managing their gut symptoms reasonably well, but they're also dealing with eye inflammation or skin issues that look like little purple bumps or joint pain that moves around their body. They've been told these are separate conditions. They're seeing multiple specialists. They're on different medications for each symptom. But here's what often gets missed. These aren't separate problems. They're all expressions of the same underlying inflammatory process. So, let's reframe this, because the conventional approach often treats extraintestinal manifestations as coincidental conditions that just happen to occur alongside your Crohn's. But that's not what they are. Extraintestinal manifestations are symptoms that occur outside the digestive tract, but are directly related to the inflammatory bowel disease process. They can affect your joints, your skin, your eyes, your liver, even your bones. And here's the part that surprises people. Sometimes these symptoms flare when your gut is flaring, but sometimes they don't. Sometimes your gut can be relatively quiet while your joints are screaming, or your eyes are inflamed, or you've got skin lesions that won't clear up. The mistake is thinking that because they're happening in different parts of your body, they need completely different treatments from completely different specialists. But what you actually need is an understanding that this is systemic inflammation with multiple expressions. And while you absolutely need your medical team, your gastroenterologist, your rheumatologist, if you have one, your dermatologist, etc., you also need an integrated approach that addresses the underlying inflammatory drivers. Because treating each symptom separately without addressing the root problem is like mopping up water without turning off the tap. So, let's talk about the practical approach to managing these extraintestinal manifestations. This works alongside your medical care, not instead of it. Okay, to begin, you have to know what you're actually dealing with. The most common extraintestinal manifestations fall into a few categories. One is joint symptoms. This can be peripheral arthritis, usually in your knees, ankles, wrists, or elbows. It can also be axial arthritis, which affects your spine and sacroiliac joints. This is a lower back pain that's worse in the morning and gets better with movement, not worse. Eye inflammation. Your eyes get red, painful, sensitive to light. This one needs immediate medical attention because untreated eye inflammation can actually damage your vision. Skin manifestations. The two big ones, which look like tender red or purple bumps, usually on your skins, and also one which starts as small pustulas and then can turn into painful ulcers. There's two big ones. Then there are less common ones: liver involvement, bone density issues, mouth ulcers that just aren't from nutritional deficiencies. The point is, if you have Crohn's and you're developing symptoms outside your gut, don't assume they're unrelated. Ask your gastroenterologist directly whether this could be an extraintestinal manifestation. Secondly, you need to understand the two patterns. This is important because it changes how you approach management. Some extraintestinal manifestations parallel your gut disease activity. When your Crohn's flares, they flare. When your gut comes down, they come down. Joint pain often follows this pattern, so does some eye conditions. Other extraintestinal manifestations have an independent course. They can flare even when your gut is quiet. Axial arthritis often does this. So does other kinds of eye inflammation. So why does this matter? Because if your symptoms parallel your gut disease, then getting your Crohn's under better control often improves the extraintestinal symptoms too. But if they follow an independent course, you might need targeted treatment for those specific symptoms even when your gut is doing well. My husband had peripheral arthritis that always showed up when his Crohn's was active. Once we got his gut inflammation under control, his joint pain resolved. But I've worked with clients who have different types of spinal arthritis, and their back pain continues even when their gut symptoms are minimal. They need specific strategies for the joint inflammation. Third, address the shared inflammatory drivers. Here's where the naturopathic approach becomes really valuable, because whether your extraintestinal symptoms parallel your gut disease or not, they're still driven by systemic inflammation. And there are specific triggers that can amplify inflammatory responses throughout your body. Food sensitivities are a big one. Not just the obvious gut irritants, but foods that trigger immune response. Gluten is common, not because everyone with Crohn's has celiac disease, but because gluten can trigger inflammation in susceptible people. Dairy for some people, nightshades occasionally, especially with joint symptoms. This doesn't mean you need to eliminate everything, it just means paying attention. If your joint pains gets worse after certain food, well then that's information. If your skin lesions flare when you eat dairy, well then that's a pattern worth noting. Gut barrier integrity is another shared driver. When you have increased intestinal permeability, leaky gut in plain language, you get more immune activation, more systemic inflammation. This affects both your gut symptoms and your extraintestinal manifestations. So, supporting gut barrier health can reduce inflammation throughout your body, not just in your digestive tract. Things like L-glutamine, omega-3 fatty acids, stress management, they're going to help. My son's joint pain improved significantly when we focused on healing his gut lining. We weren't treating his knees directly, we were addressing the underlying inflammatory process. Fourth, use targeted natural support for specific symptoms. Now, you're already working with your medical team on the pharmaceutical side. Your gastroenterologist might adjust your Crohn's medication. You might be working with a rheumatologist for joint symptoms, using NSAIDs or other anti-inflammatory medications. Natural support works alongside that. For joint symptoms, omega-3 fatty acids are genuinely helpful. The research is solid on this. Curcumin can reduce joint inflammation, though you need good absorption, so look for formulations with black pepper extract. Gentle movement is crucial. Swimming, walking, yoga, because complete rest actually makes joint pain worse. For skin manifestations, zinc is important, especially if you have pyoderma gangrenosum. Vitamin D status matters. Get your levels checked because low vitamin D is associated with more severe extraintestinal manifestations. For eye inflammation, this one you need an ophthalmologist. Do not try to manage eye inflammation on your own. But supporting overall inflammation with omega-3s ensuring adequate vitamin A status, and managing stress can all help reduce recurrence. Don't underestimate stress and sleep. I know, everyone talks about stress, but here's why it matters specifically for extraintestinal manifestations. Stress directly amplifies systemic inflammation. I've seen this pattern repeatedly. Someone's managing their Crohn's reasonably well, then they hit a stressful period, work deadline, family crisis, major life change, and suddenly their joint pain flares, or they get a skin outbreak, or their eyes get inflamed. It's not coincidence. Stress hormone, like cortisol, affect immune regulation. Chronic stress shifts your immune system towards more inflammatory responses. And sleep is where your body does repair work. When you're not sleeping well, inflammation stays elevated. Your immune system doesn't regulate properly. Both gut symptoms and extraintestinal manifestations get worse. So, this isn't just wellness fluff. Managing stress and prioritizing sleep are concrete interventions that reduce the inflammatory burden during both your Crohn's and your extraintestinal symptoms. So here's what this looks like in practice. You're not bouncing between specialists, getting separate treatments for separate problems, feeling like your body is falling apart in multiple directions. Instead, you understand that your joint pain, your skin issues, your eye inflammation, they're all connected to the same inflammatory process. You're working with your medical team on targeted treatment for each manifestation, yes, but you're also addressing the underlying drivers: gut barrier health, food triggers, stress, sleep, systemic inflammation. You know which symptoms parallel your gut disease and which ones have an independent course. You can have informed conversations with your doctors about whether adjusting your medication for Crohn's might help your joints or whether you need additional targeted therapy. And you're using natural support strategically, not instead of medical care, but alongside it to reduce the overall inflammatory burdens. You're treating yourself as a whole person with one interconnected inflammatory condition, not a collection of separate body parts with unrelated problems. Now, if this helped you understand extraintestinal manifestations better, share it with someone who's dealing with symptoms their doctors keep treating as separate issues. And if you want personalized guidance on managing both your Crohn's and your extraintestinal symptoms through an integrated approach, well, that's exactly what we do in our one-on-one coaching. You can also connect with others navigating this in the Crohn's Method community. I'll see you in the next video and have a beautiful day.